When the earthquake struck Haiti, images of death and devastation stunned the world, and the world responded, sending food and medicine, money and manpower to help the country rebuild. 3 months later, we returned to Haiti to check on the progress there. What we found is it's painfully slow. More than 2 million Haitians are still without a real home. Some 800,000 of them are living in the 875 tent cities throughout Port-au-Prince. And next month, they'll be facing the rainy season, bringing with it flooding and disease. For Haiti and its people, it is a long road back.
This is a tent city, where an actual tent is a luxury. Here, people have become masters at making something out of nothing. Even kids are making kites out of discarded paper plates and pieces of plastic bags. Formal education is a luxury, too. A few schoolrooms have sprung up, and when I arrived, the children couldn't wait to show me.
So every day you have school?
We think there are about 13,000 children here. About 250 so of them are in school that we're working
250 out of 13,000.
Yeah.
It may be called Parc Jean-Marie Vincent, but there is nothing park-like about this setting.
At one point in time, this land was the Haitian military airport. It was then transformed into a massive sports complex. But following the earthquake, it became an impromptu urban settlement with just a few hundred families. Now, 3 months later, more than 48,000 people live here in conditions that have to be seen to be believed.
Ankle deep in mud.
Dr. Louise Ivers is an infectious disease specialist and the clinical director of the organization Partners in Health for all of Haiti. She oversees the medical care here, but as this tent city has grown, so has her role. She's now the de facto mayor, and on this day, our official tour guide.
You call this camp the most vulnerable. Why?
Because it's the most underserved camp of all the camps in Port-au-Prince. It's one of the largest ones. It's one of the most in risk, and it has the fewest number of organizations helping here. The basic human rights issues of what should be done in an emergency still hasn't really reached that level, even 3 months later.
To say these conditions are unsanitary would be a massive understatement.
Mud and filth and sewage. There's garbage everywhere. There are rats here that are biting children. This place, especially when it rains, is just a place that you wouldn't even keep your animals in, frankly.
What kind of diseases occur in these kinds of unsanitary conditions?
So diarrheal disease is probably one of the biggest ones. Typhoid is very common. When there's standing water like this, like there is in the drainage canals, you get malaria, dengue fever.
Which will just put more misery on top of misery.
Yeah.
And you sleep on the floor? So they have one bed in there for five people and no bed in here at all.
No. She sleep on that right here.
Ah, on the rug here. Do most of these tents, Louise, have just basically people sleep on the ground?
Yeah, or else if they can find some wood, or it's just some plywood that he's made a bed out of.
As if these deplorable living conditions weren't enough and simply surviving wasn't a daily challenge, many here are also worried about their personal safety.
It's particularly vulnerable for women because there's not enough security here. There's not any police patrols at nighttime, and so there are cases of violence and fear of violence and threats of violence. It happens at night when people are going to latrines or if they're going to get water. I mean, none of these dwellings are secure against entry. There's a couple of lights, but not sufficient to actually make someone feel safe.
Almost on cue, a UN security detail arrived on the scene.
Apparently there are a lot of women who are being sexually assaulted at night. Can you all provide more security for these people at night?
Yes, we are doing it. At night also we are doing foot patrol with all our FU. And as long as we are present, we are ensuring that such things are not being.
But are you here at night in any kind of sizable number?
Yes.
Really?
There was no security to protect this 21-year-old mother of a 3-month-old baby.
So 8 o'clock at night, and you were going to use one of the latrines?
Yes.
And they approached you.
While I was walking, I heard them say stop, and I heard them say again stop, but I kept on walking, and they put their hands on me.
And all 3 guys raped you?
Yes.
Camp leaders have emerged to try to maintain some order and give residents a place to file complaints. But they say an accurate number for sexual assaults is hard to determine because
They don't actually go and make a proper complaint about it. They don't want to be stigmatized. They don't want to be subject to more violence.
Louise Ivers is weary and frustrated and knows there are limits to what she can do.
We're partners in health. We need partners. We need people who are engineers who will come and do the engineering part with us.
Why aren't other organizations, why isn't the government, why aren't more things coalescing, I guess?
Whose job is it to take care of the Haitian people who've been victims of the earthquake? It's the international community represented by the United Nations as a coordinating mechanism to support the government of Haiti.
Is the UN not doing its job here?
Well, somebody's not doing their job right. Because if this is as good as we can do, it's certainly not good enough.
We received an email today from Dr. Ivers who said that since we visited 2 weeks ago, things are improving. Mud and garbage replaced by new gravel in some places, and there has been progress constructing drainage canals.